Now to a new First with Kids. Today we are talking about heart murmurs.
While this can sound scary for parents, heart murmurs are extremely common in children, and usually they aren't a cause for concern, but sometimes they can be a sign of a more serious condition. Dr. First is here to explain.
Parents have been sounding off to me with lots of questions about heart murmurs in their children. Well, let me get to the heart of the matter and provide some information on this topic. A heart murmur is simply a noise heard by a stethoscope between the beats of the heart due to the flow of blood through the heart. In fact, it sounds like water flowing through a hose. While the term heart murmur may be scary to hear, for most children this is an extremely common issue and doesn't mean anything is wrong. Just that blood is whooshing through the pipes and chambers of the heart, sounding louder if blood is rushing faster. So when do we worry most about heart murmurs? We worry most in infants at birth and in the first few months of life, since a murmur might be then a signal that there's a congenital abnormality involving the heart, perhaps an abnormal connection between chambers or problems with valves controlling blood flow in the heart or the major blood vessels coming from the heart. If a baby appears blue in the face and has a murmur, which occurs rarely, your child's healthcare professional will do other tests, such as a chest x-ray, to diagnose whether or not a heart problem exists, and if so, will refer your child to a pediatric heart specialist who will do an echocardiogram or an ultrasound of the heart to determine the diagnosis and further treatment. When a child reaches preschool and school age and is noted to have a murmur, this is usually less cause for concern. By examining your child and listening to the sound, your child's healthcare professional should be able to determine if further testing is needed, but most of the time, it's not. If the murmur is just due to blood flowing noisily through the heart, treatment's not needed, although a follow-up visit or two might be requested to make sure the sound is not changing or has gone away. If the flow is stronger because your child is anemic due to low iron and needs to make more red blood cells, iron therapy might be required. Otherwise, no therapy is indicated, and there needs to be no restriction from sports or other physical activities for what we call an innocent murmur due to that noisy blood flow. So when do we otherwise worry about a murmur in an older child? Only if it's accompanied by rapid breathing, chest pain, or an older child being very tired or passing out, but these are very rare occurrences. Hopefully, tips like these will allow you to not miss a beat when it comes to knowing more about your child's heart murmurs. This is pediatrician Dr. Lewis First from the Golisano Children's Hospital at University of Vermont Health, reminding you to always be first with your kids.